And I see the toll it's taken on people's mental health, on children, on parents, and I could go on. But sadly, I have to announce the latest COVID death, a man in his 40s. My thoughts and prayers go out to the family during this difficult time of grief and mourning, and that brings our death toll up to 454, which, again, I want to say to the families, my prayers and condolences go out to you. To the people that want to categorize it to the flu or other things, and we have to move on, and it's only 0.001. You know, I know that. We can compare it to everything. We can compare it to everything going on. But here's a virus that continues to morph 14 times later, a new variant from South Africa, and it keeps changing. And we can't get out of this nightmare, unfortunately, that we're in. At my last COVID briefing, it was back on November 24th, just before Thanksgiving. Since the holiday, there's been 1,869 new infections, 85 new hospitalizations, and 14 new deaths. During that same time period last year, there were 1,553 new COVID cases, 146 hospitalizations, and 21 new deaths. So more infections in 2021, but fewer hospitalizations and deaths, even though we still have people passing away. And you can contribute that to people getting vaccines, getting the first and second shot and the booster shot. So far in December, there's already been 9 people that passed away, putting us on track for the deadlier month than November. 4 deaths were recorded in the first week in November of this year, and 11 people were reported in the first week of December of this time last year. So again, looking at the numbers and going through, we can argue any which way. More infections, less deaths, less people in the hospital, which is good, meaning the vaccine's doing its job, but more people are getting infected. And people have argued with me when I've been out and saying, how's that possible? You know, the vaccine. And I go, because how's it possible? No one's wearing a mask anymore. No one's socially distancing. No one's doing the 6 feet apart. No one's coughing into their arms. We've all have gone back to the way it was 21 months ago. We never said, and I believe Rory, I don't want to speak for Rory or anyone else, we've never said that this was going to cure it all. We just said it was another tool in the arsenal to help you from going into the hospital, hopefully, or the ICU or dying from it. We said you can get it and you can contract it, and hopefully you have no signs and symptoms, but if you don't realize it, you're passing it on to other people. And we have said if you're in a full room where everyone's vaccinated, you don't have to wear a mask. You know, and it's tough. As predicted, since Thanksgiving, we're seeing more infections after families and friends gathered to celebrate for the holiday. Today, we're also reporting 157 new COVID infections since yesterday, continuing the trend of new infections well into tripling the digits, though we haven't had a high of above 200 in a few days, which is good. Our daily average in new positive cases is 183.8. Since yesterday, there's also 10 new hospitalizations. 52 county residents are now hospitalized at this moment, up from 44. There are currently 11 patients in the ICU, up from 7 yesterday. 1 individual currently in the hospital is below the age of 18. Hospitalizations are really the most important thing we've been monitoring. It goes back to the argument when the previous governor had the matrix and the color zones and this zone and that zone, and we were all trying to figure out what zone we were in or what matrix we were using. It became very clear to us, hospitalizations are the key. Can the hospitals handle the influx of patients? Can they handle the ICU? And how can we work with them to make sure that there's hospitalizations bed? Because I remember the conversation a long time ago I had with Rory when we talked about when we saw out in California and other Texas and other places where they were setting up tents outside parking lots and had patients in parking lots instead of cars. They lost the battle of having hospitalizations beds and percent of beds that we have. And that's will get me into why Rory and I are here in a minute. So we're likely not seeing the full impact of the last surge of COVID infections, and we'll see in our hospitals. Typically it takes about 2 weeks, like I said, so December 9th is about 2 weeks from Thanksgiving, and we'll see about the infections and surge of infections going forward from there, and hopefully we see that number go down. The best way to protect our residents is by getting vaccinated. We say that time and time again, and making sure they're able to get their booster. All adults who have been fully vaccinated for 6 months, for the last 6 months, are now eligible to get their booster, which we highly recommend that you do that. We can continue to offer the vaccination every day of the week, and our county health department is doing the same thing, as well as at schools. This includes the Blue Creek Elementary in Latham, Gilliland Elementary School, Myers Middle School in Albany, Sand Creek Middle School in Colony to follow. So I said, people, please go to our website. You can still go around the region and find where you can get the booster shot or your first or second shot. Of the 52 county residents currently hospitalized, and I want people to listen to this carefully on Facebook Live, and when you look at the numbers, we always put the numbers out. We just don't put them out because of HIPAA and other reasons, and we want to make sure when we give the data, we respect people's privacy. Of the 52 county residents currently hospitalized, 69% are not vaccinated. 2% are partially vaccinated, 29% are fully vaccinated. Among the 22 COVID deaths in Albany County during the month of November, 59% of the individuals were unvaccinated. 41 were fully vaccinated. So you can see the vaccine works and protects people. 76% of all Albany County's population has received at least the first dose of 68.4% of the entire population has been fully vaccinated. It's important to remember that while the vaccine will reduce your chances of your illnesses getting worse caused by the COVID-19 or your chances of dying, it is not 100% effective. We never said it was going to be. Just like when you get your flu shot every year, it doesn't guarantee you're not going to get sick. I'll say this again, just another tool in the arsenal, especially with those with underlying health issues, obesity, heart conditions, diabetes, high blood pressure. I could go on and on and on. It's one of the reasons why we need adults and people over the age of 5 get their booster shot. Again, to help us get through this. We continue to monitor the latest surge of COVID coming through the capital region. We've been evaluating the effectiveness of Albany County going it alone in terms of new COVID restrictions and regulations, and we're exploring the options we had to with partnering with our neighboring counties, as I'm doing today here with Schenectady County. The only way new restrictions will truly work if we do it on a regional base approach. And so when people are wondering why we haven't done anything, obviously Dr. Whalen and I have said this every time. We're following the science. We're following the data. We're following where we're going. Yes, we're having more infections, but less hospitalizations and people passing away, even though we still had people passing away from this. I commend what Mayor de Blasio did in New York City, but New York City is contained. They can't leave, really, without taking the train or driving out. If I do certain restrictions and Schenectady County does certain restrictions, well, are you going to shop here or go to a restaurant here, or are you going to cross the river? Or are you going to go up to Saratoga? Or are you going to go over to Montgomery County and go elsewhere that have no restrictions? And I'm not saying that's the reason we're basing our decision, but as I was saying earlier, people have fatigue. Everywhere I go, we talked about December 7th, 1941, Pearl Harbor. Besides myself and a few handful of people in the media had masks on, the whole room, no one did. You watch any football sports this weekend, and they're all like, oh, it's an outside arena. But you're on top of each other with 60,000 people. Is it truly outside without wearing a mask? And unfortunately, people have moved on. And it gets us to the mental health of everything. And that was the discussion we had with Saratoga, Rensselaer County, Greene, Columbia, Warren, and Washington County, is how we can do this as a capital region moving forward and trying to get us through it. And I respect the decisions the other counties have made of governing the way they feel that they want to govern. But again, we're not over this, and unfortunately, again, we're not like New York City where I can make a decision that's just going to affect Albany County's population. The same thing with Schenectady. So we really need to work together. So we really need to get all capital region counties on board to have a real impact on the infection rate. And we haven't been able to do all that, to get everyone in sync to come up with the same messaging. And that's going to change. And again, I will respect what they're doing in their counties. This is also a question of enforcement. Who's going to enforce it? If we go to a strict mandate saying you have to wear a mask. Remember when we went through this issue? I didn't forget. Who was going to enforce it? Who was going to go out and tell people and give them fines? It wasn't happening. It was supposed to fall to the sheriffs or to the police departments. And then what I really realized, and lessons learned through this whole 21 months, is people's mental health. People fighting with each other because someone would say, put your mask on, and they literally were fighting with workers in restaurants. How fair is that? Someone's just trying to go to work to make a living, and now they got someone in their face, knocking them down or screaming at them to take their mask off, and the masks don't work, and so on and so forth. And it was one of the things Rory and I and everyone else went back and forth with is what is damaging more, COVID-19, the last 14 variants, or mask, and people just coming out after being shut down. And I will never recommend to close completely like we did the last time, because the ripple effect on a variety of things we've talked about, on people not getting relapsing with opiates or drinking, people who didn't go get checked for colon cancer, or they were dealing with other issues and died because they were afraid to go to the hospital. I mean, there's things we're just finding out months later that really had a negative impact on everything else. You argue about schools, about kids being in schools with masks, and one of the debates, I'll say debates because I'm not arguing with anyone over this. I hear them, I say, hey, I hear what you're saying, and I walk away, because I'm not going to win either way. But when parents go, well, does COVID-19 not happen on school buses because my kids are jam-packed on a school bus, but the minute they get off a school bus, they got to be 6 feet apart or 3 feet apart, and I'm like, I know, but we have to continue to move forward as a society. So again, we need to, we're still dealing with the mental health issues caused by ongoing pandemic and the impacts of the economy shutting down. But I do want to say that simply because we haven't implemented any new restrictions doesn't mean we aren't relying on people to do the right thing. A public education is an important piece of the puzzle to get people to change their behavior when it comes to COVID-19. So I'm up here with my partner, Rory Fluman from Schenectady County Manager, to jointly issue official public health advisory in both counties stating that masks are highly recommended when entering indoor public space, including private businesses, and wear a mask indoor, including vaccination, regardless of vaccination status. I do want to turn it over to Rory if you want to say a few words.
Sure. Thank you, Dan, for having me out here to Albany County. In Schenectady County, many of our statistics and what Dan was talking about are very similar. Our hospitals are not overrun, but yet 2/3 of the folks in there have chosen to be vaccinated and 1/3 have not. I'd even take it one step further, going into our 28-bed ICU in Schenectady County. We only have one hospital, Ellis Hospital, out of those 28 beds. There's only 4 individuals that actually have COVID-19, one who was actually vaccinated. So why is that? It's due to vaccination booster shots, the ongoing education and information that is given to the public, that here we are with boosters and vaccination rates is still the primary way to fight COVID-19. And we've been in this for close to 2 years now, and the fact that we have vaccines, the fact that we have the ability to boost people will help save lives. It will help with social mitigation factors. Masking is important. So when Dan was starting these conversations about kicking around what should we do, well, if we're arguing something, it should be from a regional approach. The simple fact is every county in upstate is a little different. So there's a little bit different feelings, different issues as far as who should mask, who should not. Obviously, today, being Pearl Harbor Day, for me it's about citizenship. It's about wearing a mask is a good thing to do as an American citizen, and certainly on the day of today, in remembrance, what can we do for our fellow man? During World War II, we weren't so individualistic. We didn't think of maybe only ourselves and our only opinion. Public health is about community. Public health is about my effects having a direct effect on your health. And if I'm not vaccinated and I'm not choosing to wear a mask, I'm not being a good citizen. So when Dan called me up and wanted to talk about having a strong advisement for wearing a mask, I thought that's the absolute right thing to do, is to get out there, get in front of the media and say, listen, we are still in this. We may be in this for years. We don't know. But what we know now is get vaccinated, get boosters, protect your family, and when you're in public settings, wear a mask. It's that simple, and it's the only thing to do until we are done.
Rory, thank you. And like I said, it's official public health advisory that we're strongly doing from both counties. And I'm also asking private businesses to do their part in requiring masks to extend, to put up signs that are visible when people walk into their establishments that says, please put a mask on. You know, and hopefully they enforce it with their workers to wear masks and everyone coming into their buildings. And if you see the surge, you know, our numbers dropped in the summertime because it was nice out and people were outdoors. We're seeing the numbers go up because it gets colder here and people are now inside gathering. Same thing if you look at Florida, Texas, and Georgia, and I could go Illinois. You know, summertime, their numbers spiked because it's typically hot there and they go indoors. Now that they're back outdoors, their numbers are dropping. So please, just do your job, help us, and don't judge people if they're wearing a mask. If you have to put a mask on to walk into a building, get out, or go grocery shopping, or whatever you're doing, just think about you're not just only protecting yourself, you're protecting someone you love. And, you know, and that's the way you have to look at it. I'm asking everyone to put their judgments aside and to not make people feel uncomfortable about everything. And we'll get through this. Just because there isn't a mandate doesn't mean you shouldn't do the right thing, but I will say we've been seeing spikes here in Albany County throughout the region. We're actually doing far better than most other regions. This is especially true if you look at western New York, the Finger Lakes, the North Country, central New York, and Mohawk Valley. But we can't put our heads in the sand, and we need to continue to fight back. There's always room for improvement. And again, I want to thank Rory Fluman, Schenectady County Legislature, the chair there, and everyone else. And this just gives us another tool in the toolbox we need to slow the spread of COVID, to stop our hospitalizations from getting overwhelmed, and surge of hospitalizations, and ultimately will save lives. As you know, elective surgeries have come to a halt in 4 of the hospitals up here in upstate New York. That affects people who are getting knee replacements or just whatever minor surgery, cuff, whatever it might have been, the change quality of life is now they can't get it because of what's going on. So we need people to roll up their sleeves, get vaccinated if they haven't, and to get the booster shot if they haven't gotten it yet. We need people to wear their mask at indoor public spaces and crowded places and large gatherings. We need people to get their flu shot if they haven't already, and to stay home if you're feeling sick. We also need people to get tested if they're experiencing any symptoms. And finally, we need people to think about their neighbors, their friends, their families, and their community as a whole. Because if you truly, truly do care about them, you will do the right thing and follow these preventive measures. I also want to say we've been working with schools. The other issues, we've been working on testing with the state, putting it through NISAC and trying to get free testing set up like we had before. The other issue, we are working with schools, so I'm prematurely going to put this out there that we've been seeing like a big complaint we get if a kid has the sniffles, if his nose is running or a little cough, they're being sent home. They got to get a PCR test to get back in school. So we're working out with the superintendents here in Albany County to give them quick swab tests to keep a kid in school from going home. Education is important. We can't keep continuing to go remote, and we got to keep kids in school. So thank you to everyone doing the right thing. And please remember, I've said this, and I was hoping I was wrong. It's a marathon, not a sprint. We'll get through it, and it's just going to take longer than we all predicted. Any questions?
So with the health advisory, I want to make sure I'm hearing this right. It's strongly encouraged, not mandated, not required, right?
Correct.
Okay, when you spoke earlier, you said something that stuck out. I'm not winning either way when it comes to mandating these sorts of things. If the numbers keep going up, is that something that you still would never do?
No, because a lot of it, I've learned, and
Sure.
I want to speak for Hurry, I've learned the last 21 months with all the matrix and the color zones and, why businesses shut down and how they could open up based on percent positive. It really is coming down to hospitalizations and what, our hospital shares have bed capacities in ICU. That number's a little lower, and you have to put into consideration that healthcare has been in a war for the last 21 months. People are retired, people that could have retired left, people just left that industry because, it's just hard to be in the last 21 months. And, so that has an effect on the bed ratio, and that's what we're basing it on. And if it gets to a point where, and I hope we don't, then we will have to change it. But one of the discussions Rory and I had with other county managers and other people that, if we do enforce masks, it's not like New York City. Who's going to enforce it? And then it just causes more mental issues than the good it would do to wear a mask. So I don't even want to go down that road. I'm just saying we're pleading with people.
Sure.
Please do the right thing. COVID's not gone. I know you're done with it. It's not done with us. Any other questions?
With the upcoming lacrosse league starting, will there be any rules, regulations looking forward? How intense are you looking into it, and what are some of the options if it increases?
I actually, I'm going to use some of Rory's words. We have to move forward. We have to learn how to smartly do things. So I think you said if with lacrosse coming up, we already put guidelines in our places that you got to show your COVID-19 card. You have to, or if you don't have the, if you don't have your vaccine card, then you have to have a negative test. So we have protocols in place. I don't see that changing. And again, we got to continue to move forward, but we have to still stay smart about it.
Also, Dan, how do you expect, this is to raise awareness, how do you expect people to change behavior? I mean, what's the point of this today? What message are you trying to get to the public out here?
We're trying to get out that we haven't stopped working in this. I mean, I know there's other things, life goes on, but we're still seeing a huge infection spike, even with the vaccines and the good job both Schenectady County did and Albany County. What I'm hoping to get out of this is saying we don't want to do any mandates. We know that people don't want mandates. We know the numbers show people don't want mandates. But we're trying to hope that this will get them to really look at COVID again and say, hey, look, let me do my job. Let me just wear a mask when I'm out. And let me stay 6 feet apart, cough into my arm, and clean my hands, and try to lead by example.
With the numbers going up, what's your game plan if the numbers do increase throughout the next month or two? What's your game plan looking forward?
So, I'm hoping this joint press conference we're having is going to change some of the habits in both our respective counties and in the capital region. I'm also hoping that our numbers start to go down after the 9th, because the 9th would be 14 days. And I'm hoping that this starts to subside and we get back to some type of better normalcy. And I'm hoping we don't have to make the next step. But again, which will make that decision is if we start to lose hospitalizations, beds, and ICUs, which we made some prep stuff again, like we did a year ago when we got our old nursing home ready to receive patients. We have done the same thing quietly, moving along and doing things we need to do if we happen to go down that path again.
And we have been asking people to social distance, wearing masks, et cetera. What is the real purpose of the public's health advisory? You've already been asking people to do all these things. Why do you think this will change come December?
Well, certainly, you know, in the news cycle, you've seen reports coming out of New York City. You've seen reports coming out of other places in the country on how individuals and county governments, city governments are trying to combat COVID in its form. You know, we're days away from 2022. You know, this first started in 2020. So really, it's just good practice to kind of constantly review what your public notifications are. You know, you always want to kind of circle back and remind people. And when we first started in COVID-19, it was test, trace, and isolate. You know, before we had the vaccine, you know, I said it, Dan said it, test, trace, and isolate. Public health's responsibility and how to safeguard the public and to fight COVID-19. The minute that vaccine hit, it was a game changer. You know, it's so important, it's so critical, not only to wear that mask in public, but to become vaccinated and to get your booster shot. And so our public health departments are so busy with those efforts, you know, to circle back and go after, quote, a mandate on the individual to wear a mask. You know, it's analogous to when travel restrictions, you know, were a year ago. And somehow, you know, the Dan's department, the sheriff's department, my departments were responsible for telling people not to travel to another state or travel to another county. It was nearly impossible to execute that. And again, we relied on the public stage to try and encourage people not to do those things because it's good public policy. So always follow CDC, follow New York State forward. And the tremendous help that the state of New York has given counties has been tremendous. Just the money that we got over the summer to be able to go into schools and to offer testing supplies, to be able to offer vaccines, to be able to offer free masks for kids, was a reason why kids got back into school in September. Let's not forget where we were. You know, I have 3 teenage boys, and they could have just lost a whole year of school. You know, Dan's got kids. It was not a good time a year ago. So despite, you know, our appeal to wear masks, that is nowhere near any parent that had a child out of school last year. That is nowhere near any adult that lost a parent or a loved one because somebody in a family or in a gathering chose not to be vaccinated. So us strongly recommending mask use is really light compared to, you know, the life and death, you know, that Dan will report periodically, or where we've been over the past 2 years. So yes, it is only a strong advisement, but we're standing by it, we're sticking to it. And if we need to change it down the line because, you know, COVID transitioned yet again, then we'll do it because that's what responsible people in government do.
People checked out of COVID. We need you to check back in. If you take anything away from this conference, check back in, read everything that's been going out, inform and educate yourself, and we'll get through this. But that's the issue. People have just moved on.
Will the businesses be like targeted, not targeted, but I don't know, like hurt in any way if they don't abide by these rules? The word is leaving my mind right now, so I'm sorry.
No, I read an interesting article, I think it was Steve Barnes yesterday, and to you about like 3 restaurants that say you have to show your vaccine card or you can't come in. I think one was in Albany County, one might have been in Schenectady, and somewhere else. You know, their whole business model had to change. So no, I don't think it's going to affect them. I think people who feel comfortable go out to dinner. You know, they wear their mask. I went to a restaurant yesterday, had a meeting, or actually it was Sunday, I think, whatever day it was, and the guy was like, you got to walk in with your mask and you take it off. And what's that doing? I'm just like, yeah, have a good breakfast. You know, again, you know, these people have to work there and they have to survive. So the last thing we want to do is put more restrictions on them because so much has been thrown at them, the way they changed their whole model to survive. And typically, this is the time that they make their money during the holiday. They were doing good, but with the surge of everything else, restaurants, you know, few that I talked to, so this is just not data driven. are seeing a decrease because people don't feel comfortable and safe to come out. Maybe by everyone wearing a mask, they'll feel safer. And I've talked to people that are like, do that mask mandate, I'm behind you, because they want to go in and see everyone masked up. I don't know if that answers your question.
Thank you. Last question from me, sorry. It's off topic. Looking out the window, it's snowing. I know that snow's moving in tomorrow too. Can you both speak to, like, both of your counties, how you're preparing for it?
You know, I'll let, go ahead. You go first.
Sure, yeah, we have 205 miles of county highway system in Schenectady County. You know, we have 40 plow drivers, 2 shifts, 10 to 12 hours each shift. You know, we're out salting, you know, we have advanced, the wonderful thing with technology. You know, you have artificial intelligence meteorological services to tell you exactly where in your roads, where you need to be, times of the day or times of the night. So in Schenectady County, our plows are out, we're salting. You know, again, that's one of the, I don't want to use the word mundane, but that's the normal public safety that we would be rather talking about. So please ask me about salt trucks.
Yeah, no, Rory, I agree. We do the same thing. And, you know, right now we'd be stressing out. 21 months prior to this, I'd be stressing out whether or not we had a snowstorm and if I had to close the county buildings. Now it's like a no-brainer when I'm like, okay, we can go remote. We've done it, so it's no big issue. So I'll never have that stress of staying up to 5 in the morning to pull the plug on whether or not to close or not. So it's a walk in the park. So I'd rather deal with the snow and the salt and them issues or people complaining because we might have knocked down their mailbox versus this.
But we don't knock down mailboxes in Schenectady County.
Well, you know. All right, we don't either. Thank you, everyone. Be safe out there.